Hi, I'm Elizabeth Wise, the president of Lehigh Valley Hospital Pocono. Your health deserves a partner, and that's where we come in. Each month, medical professionals from Lehigh Valley Health Network Pocono will bring you topics that are of interest to you. This month, our topics include plastic surgery after weight loss surgery, information about breast cancer awareness and mammograms, and why it's even more important this season to get a flu shot. Joining me now is Dr. Charles Herman with LVPG Plastic and Reconstructive Surgery located in East Stroudsburg, talking about weight loss and when you should consider bariatric surgery. Hi, Dr. Herman.
Good to see you.
So the first question is, tell me a little bit about your role at Lehigh Valley Health Network Pocono.
I've been in the health network since 2005, and I'm a plastic surgeon primarily at our Lehigh Valley Pocono campus.
So there's been a lot of attention in the news about weight loss surgery. Why do you think there's been such a significant increase in these types of surgeries?
So it's a great question. We've seen a tremendous increase in the popularity of weight loss surgery. I can personally speak to how this surgery has changed tremendously over the last decade or two. 20 years ago, when I was a general surgery resident on my path to become a plastic surgeon, these surgeries would often require week-long hospital stays, had high risks. The surgery has evolved tremendously over the last 10 to 20 years. Many of these procedures now are done on an ambulatory basis, where patients will go home the same day or for a short stay overnight. And because the procedures themselves have become so much easier, safer, and have much less recovery, it's made the procedure much more popular. A lot of the procedures now are even done laparoscopically. And so that's really changed the face of bariatric surgery and really contributed to how popular it's become over the last decade.
So what happens during a weight loss or bariatric surgery?
So there really are two different types of bariatric surgery or weight loss surgery. The basic principle is that shrinking the size of a person's stomach or reducing how much intake they have will reduce their weight. The other way to do that is to reduce the amount of nutrients or calories that are going into the person's body from what they're eating. So the surgeries themselves, they basically either reduce the amount of food that someone is taking into their system or reduce the amount of calories that are being absorbed into what we call the gastrointestinal tract or the person's internal body. And that's how the weight ends up being shed. It typically takes about a year or so. It's not an overnight result for the weight to stabilize after the surgery.
So you really have to be prepared for that, knowing that it's not a quick fix.
That's right. It's really it's a long process. It's a process that involves, as in going under any surgery, educating yourself about the surgery, making some dietary and lifestyle changes, not just after the surgery, but before the surgery, to prepare yourself, get yourself in the best shape for the surgery. And as a result of the lifestyle modifications and the surgery itself, it really can change the way patients feel about themselves as well as their health and their weight.
So switching gears a little bit, what happens to all the extra skin once the patients lose weight?
Right.
And then are there plastic surgeries that are designed for this?
Sure. So that's when I end up seeing most of these patients is they come to me as a plastic surgeon when they've lost the weight. So typically a year to 2 years after the weight loss surgery. I routinely will see patients, unbelievably, they've lost 200, 300, 400 pounds even.
Wow.
Literally hundreds of pounds after the operation. And what ends up happening is that a lot of these patients have extra skin that may hang after the surgery that needs to be tightened. Structures in the body that, because the weight has changed so quickly, didn't have time to adjust or didn't have the elasticity to adjust, that they come to me at that point for surgeries to not only in many cases improve their appearance, but also that are causing health problems in addition to cosmetic problems.
Okay. So does all the extra skin that can hang after weight loss surgery, is it just a cosmetic concern? Or you mentioned there may be medical issues associated with the extra skin.
Exactly. As we were saying, what can happen is that extra skin can rub against itself. We often see patients who have infections or skin breakdown under their abdominal skin, which can be hanging, under their arms, under their breasts, in their thighs. And it's not just women. About 20% of our patients are men. It's become a popular procedure among men also. So we have the issue of the psychological issues that are helped by the cosmetic portion of the surgery and making patients feel better about themselves from looking better, but also often medical issues, infections and rashes and other types of problems from all that extra skin that results from the weight loss.
Okay. So are there special plastic surgeries done for these patients? Or are they the same ones that plastic surgeons have been doing for many years on patients who have not had massive weight loss? Maybe you can say, is there a difference between the two types of plastic surgeries?
Yeah, I mean, it's a great question because we actually had to modify a lot of our operations because we didn't see patients who had routinely the amounts of weight loss that these patients had until really the advent of bariatric surgery. In fact, about 10 years ago, you see, I wrote a book that is used across the world for helping educate plastic surgeons on how to do some of these procedures. The body sculpting, as we call it, operations can be very different than your traditional cosmetic surgery operation. In fact, the book was even translated into Spanish, as you can see here, because not only are these surgeries popular in the United States and North America, they also are very, very popular in Latin America as well. And we've had to modify a lot of our procedures because there were unique considerations in these patients. Different types of scar placement because of the different types of skin excess that we were seeing, different types of muscle tightening, because we hadn't seen patients who had lost this much amount of weight so rapidly really until the advent of bariatric surgery. That forced us to modify a lot of our standard procedures and make them better for these patients because their anatomy, the way their body looked and the different structures in their body were severely changed after they lost this amount of weight. And as a result, we had to modify our plastic surgeries in order to give them the best result. Even our videos that go along with the book that are live surgeries.
Yeah, it looks like a DVD that accompanies it
DVD accompanies it. And we had surgeons from around the world contribute to this book. So a lot of the chapters are written by experts in their individual surgeries, whether it's a facelift or a tummy tuck or abdominoplasty or an arm lift or brachioplasty. We had experts contribute to what we wrote so that someone reading that book can see really what's being done in different parts of the world, and as well as pick and choose the best operation for their patient, because every patient is different. That's the part of plastic surgery that, for me is so attractive, that every operation is different because every patient is different.
Well, thank you for all that you do for us, for our patients and our community. Sounds like you really help a lot of people after they've had the surgery to help remove the excess skin. To help them have an even healthier lifestyle, and that's mostly very beneficial to our patients and our community. So thank you very much.
And rewarding for me to be part of that. Thank you.
This is a marathon, not a sprint. But we need to go back to work. Our kids need childcare. We need groceries, and sometimes we need a hug. But we also need to be smart. When you have to be around others, you need to wear a mask. It's clear that people without symptoms can be a carrier and spread the virus. So cover your nose and mouth, and let's work together to reach the finish line safely. Our community's health depends on it. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all. So I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN, you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN, you have a partner you deserve.
Joining me now, we have the opportunity to discuss new techniques in the fight against breast cancer with surgical oncologist Dr. Krista Bott. Welcome, Dr. Bott.
Hi, thank you for having me.
So we are in the meditation room in the Dale and Francis Hughes Cancer Center. I love this room. I said it looks like it's my backyard. So thank you for joining us to share information.
Absolutely.
So let's start out by telling people a little bit about your role here at Lehigh Valley Health Network Pocono.
I'm a breast surgical oncologist, so I perform breast surgeries on women with both benign and malignant issues with the breast.
Okay, well, thank you for what you do. I don't think I've shared this with you, but my mom is a 20-year survivor of breast cancer. Unfortunately, my aunt passed away from breast cancer, and so this topic is very near and dear to my heart. And as you know, October is Breast Cancer Awareness Month.
Yes.
So women have a lot of questions about breast cancer and mammograms. But I'm going to start with first, what exactly is a mammogram and when should I get one? And knowing that maybe depending on your age or your history, there might be different time intervals that you need a mammogram.
So a mammogram is a type of x-ray that looks for any masses, calcifications, or maybe most importantly, changes in your breast tissue from one year to the next. It's recommended that women of average risk start having their mammograms at age 40. We may start screening some women even younger than the age of 40, especially if they're high risk or if they've had family members who have been diagnosed at younger ages, so under the age of 50. Also, women with dense breasts may need additional imaging in addition to the mammograms, and those high-risk women also may need additional imaging as well. So the age of 40 is when we recommend average risk women start, and then once a year after that.
So how would I know if I have dense breasts?
So everybody gets assigned a breast density on their mammogram, so really the only way to know that for sure is to get a mammogram. And then everybody has a density to their breast. About 50% of women are dense and 50% of women are not dense.
Okay, that's good to know. Thank you. I wasn't aware of that. Can I put off getting my first mammogram if I have no family history of breast cancer? Because what I hear is some people are afraid to get a mammogram. One is because they don't potentially want to know the results, or they hear a lot of concerns about it's going to hurt. It's painful to get a mammogram.
It's not recommended. We diagnose a lot of breast cancer in women in their 40s and even some women in their 30s. So it's certainly not recommended to put off your mammogram. Most breast cancers are diagnosed in women without a family history. So even though we may not recommend that you start screening early without a family history, 40 is the age that we recommend women start without a family history.
Okay. So, and how about, does it hurt to get a mammogram?
Some people have sensitive breast tissue at baseline, and it might be a little bit uncomfortable, more of a pressure for those women. Most women have no issues whatsoever.
Are there red flags or warning signs that women should watch for in between mammograms?
Really what we're looking for in between is any changes in your breast tissue. So everybody's a little bit lumpy, so breast self-exams are something that we used to preach very, very much, used to hear all about them. But everybody was finding lumps because breast tissue by nature is very lumpy. We still recommend self-exams, but it's more breast self-awareness, so know what you feel like so you know if something changes. Also, any visual changes to your breast, such as a new nipple inversion. Some people have nipple inversion from childhood, but any new nipple inversion would be a warning sign. Or any bloody nipple discharge is a big one, or nipple discharge that leaks out.
Okay. Yeah, my mom found a pea-size lump that was very hard, and that was an indication for her that it was something different, and that prompted her to go to her physician and then ultimately see a breast surgeon.
Yes.
So what are some new developments happening in the fight against breast cancer? Because I know that you've introduced some new techniques and treatments, and what can people expect if they do get diagnosed? Tell us a little bit more about that.
So I think the most important thing to realize after you've gotten diagnosed is that worldwide we've gotten very good at treating breast cancer, and really The survival rate has increased so much for breast cancer because we have a good screening tool in mammograms that allow us to catch breast cancer at early stages for the most part when it's very treatable. One of the most recent and most important advances is 3D mammograms, so tomosynthesis mammograms, which we do have here and is becoming more and more prevalent everywhere. They're kind of replacing 2D. 3D mammograms allows radiologists to kind of see through some of the normal breast density and find out densities such as masses that don't belong. We have gotten more support from the government. Recently, Pennsylvania just passed a Senate bill, I think 595, that requires insurers to pay for the additional pieces of screening that I was speaking about with high risk or dense breasts, such as mammograms and MRIs. From a surgical standpoint, we have improved techniques drastically. 20 years ago, a lot of people were just getting mastectomies right away.
Right.
Then we moved toward breast conservation, so now a lot of people, most people in fact, get lumpectomies. We've then moved that forward, and now we do hidden scar surgery here. So we're a hidden scar center of excellence at Lehigh Valley Pocono, and which that means because people survive at such high clips these days, there's many, many women who are survivors of breast cancer 10, 20, 30 years down the road.
Right.
It's now our goal not only to make sure you survive, which is the #1 goal, but #2, I want you in 10 years to look in a mirror and not see a constant visual reminder of your breast cancer in the form of scars or asymmetry. So we do hidden scar surgery here, not scarless, but the scars are hidden. And also nipple-sparing mastectomies are something that's really becoming more and more prevalent. So the incisions with the nipple-sparing mastectomies are also hidden, and you keep your nipple. It's not something every woman can get, but it's something that's becoming more and more prevalent here and kind of everywhere nationwide.
It's wonderful to hear that we have these techniques available, you know, right here in Monroe County, and you doing the surgical technique, so we really appreciate that. One of the questions I hear is, do I need a prescription to get a mammogram? Or how easy is it at Lehigh Valley Hospital Pocono or to get a mammogram? Do I need to wait? Do I need to make an appointment? Can I walk in?
Yeah, there's actually no reason to not get your mammogram. For screening mammograms, you do not need an order or a prescription. It is best that you try to get one, especially if you see your primary care physician or your GYN yearly. They can easily order one, and then it might make the progression easier. But we have a scriptless screening mammogram program, so you can go in without an order or a prescription for a mammogram and get your mammogram. Additionally, lack of insurance coverage or poor insurance coverage should also not prevent you from getting a mammogram. We have grants that help us pay for women in those situations to get their mammogram at no to low cost.
So what I'm hearing is there's no excuse not to get a mammogram.
No excuse.
No prescription that's needed. You can walk in and get it or make an appointment.
Correct.
So thank you very much for your time. Thanks for sharing this wonderful information. I told you that this is near and dear to my heart. You know, look forward to people getting their mammogram in October or any time, right, as part of Breast Cancer Awareness Month.
Absolutely.
We've seen the concern in your eyes. You're scared, nervous, want to know if it's safe. The answer is yes. At LVHN, you'll see the extraordinary steps we take to get you the care you need safely. At all our facilities, you'll see temperature checks for everyone, that we sanitize every surface, and yes, you'll see that masks are required. What we look forward to seeing is relief in your eyes. Lehigh Valley Health Network. Your health deserves a partner.
Before I became president and CEO of Lehigh Valley Health Network, I was a doctor in the ER. I've pretty much seen it all, so I understand why you may be scared to go to the hospital or see your doctor because of COVID-19. I want to assure you that at LVHN, you will safely get the care you need. We are taking every possible step to keep our ERs, hospitals, and doctors' offices clean and safe. So please, don't neglect your health. Take charge of it and know that at LVHN, you have a partner you deserve.
I'm joined by LVPG Pocono infectious disease doctor, Dr. Suzir Gandotra, who's telling us why this year may be the most important year to get your flu vaccine and why. So welcome, Dr. Gandotra.
Thank you, Elizabeth.
So tell me a little bit about your role with LVPG Pocono.
Elizabeth, as you know, I'm an infectious disease doctor over here in Lehigh Valley Hospital, Pocono, and my job over here is to see in patients who have infectious diseases, in inpatient as well as outpatient, and I also manage the infection control department over here to ensure that there's no spread of infections within the hospital, and we also do the community education as we're doing right now.
So what can we expect this year when it comes to the influenza during the COVID-19 pandemic?
Yes, that's a very important question, Elizabeth. So this year, it's crucial. It's very important that the influenza is controlled as much as we could, especially by the influenza vaccination, since we are dealing with COVID-19. The reason for that is there are two viral respiratory illnesses, both the COVID-19 as well as the influenza. Both could be deadly, although the COVID-19 is more so. One of them has vaccination, proven vaccination, which is influenza. The other one so far does not have vaccination, does not have really proven cure as well. So we should try to control the one which we can, and that is the influenza, by giving the influenza vaccination so that the patients, the general community's lungs are healthy and they do not have to deal with two infections at the same time, which could very well happen because we are moving into the winter season when both these illnesses could easily flourish.
You mentioned this and I was not aware of it. Can someone contract both influenza and the COVID-19 virus?
I don't see why not, because as I said, the influenza, we already know that it spreads during the winter months. COVID is still percolating and we do not know when the next wave is going to come. And we are anticipating that in the winter months the numbers might increase with the kids going to school and people huddling together during the winter times, during the holiday seasons. So during that time we very well might see a surge in the COVID-19 patients, and at the same time the influenza might be surging. So you can imagine that it could be a very, very difficult situation for people as well as the healthcare or the hospital systems. So
when is the best time to get your flu vaccine? I get asked that question a lot of times. Is it available now, and then should I wait, or when should I get it?
You know, the influenza season starts somewhere around September and lasts all the way to first week of April generally, but it can always vary. The influenza vaccination takes 2 weeks to kick in. So keeping those things in mind, ideally, if you get it in late September, early October, that's probably the optimum time. But having said that, since we are dealing with COVID, I would suggest just get it. Get it earlier. As soon as you can get hold of the influenza vaccine, just get it so that we are protected from influenza.
So is it safe to get the influenza vaccine?
Yes, Elizabeth, I get this question a lot. The influenza shot, or the intramuscular injection, it is formed by the killed, inactivated viral particles. So it is impossible to get influenza from the influenza vaccine. It's killed vaccine particles which simulate the response in the body in case we get the real influenza. So the body is prepared for the real influenza illness if it comes by getting those killed particles. So yes, sure, you can get some arm soreness, you can get some low-grade temperature, but those are good signs. I like when I get those arm soreness and a little bit of feverish feeling, because I know that at that point my body is taking it. My body is responding to the influenza vaccine, and that means the process is moving in the right direction, the immunity is forming, and hopefully I'll be more protected as the season goes along and the real thing hits me.
So are there any local opportunities in the Pocono community that everyone can take advantage of to get the flu vaccine?
Yes, we are very excited to have our local flu drive clinic, which is managed by the hospital. It's coming up on October 17th. It's in the Stroudsburg Middle School, and the vaccination will be available for the general public at 9 a.m. to 1 p.m. and our hospital is really working on it to make it a successful event.
You don't even need to get out of your car to get the shot, correct?
That's the great thing about it.
Okay, so you
yes.
just roll down your window, we can give you the flu vaccine, and then
There
you
you
can
go.
drive off.
There you go.
Okay, and I also am going to be the first one to get my
I
flu
heard that.
vaccine,
Yes.
so looking forward to that.
That's great, yes.
So we are standing in the emergency room at Lehigh Valley Hospital Pocono, and I get asked a lot of questions about, is it safe if I'm not feeling well to come to the emergency room, to come to one of our express cares? I think that people are still anxious or nervous, and they ask me that a lot. I'm sure you get that same question.
Yes. That's a very valid point, and I don't blame them for getting nervous and going into any potentially crowded place and for ER for that matter. But please realize that we are taking extra precautions to make sure that our patients who come in to get other illnesses taken care of are not infected by any contagious diseases, including COVID. So we do take extra precautions in the ER. As you can go see, we have the 6 feet distancing, social distancing, making sure everybody is putting the mask on, and other precautions when they come into their individual rooms to make sure that the COVID-19 is not transmitted while they are here in the ER. So to answer your question, yes, it is safe. If I have to come to the ER, I will feel safe to come and take care of the illness which I have to take care of, rather than waiting at home and putting myself in danger by not coming here.
So really the message that I'm hearing is don't delay your care, seek treatment, either come to the emergency room, one of our express cares. We offer same-day appointments with our Pocono providers.
Yes.
So there's a lot of options that are available for the community to get care.
You summarized that well, yes.
Okay. So thank you very much for sharing this information with us. It's more important now than ever that people get their flu vaccine and continue to do the things that help to flatten the curve, right?
Yes.
6
yes.
feet apart, frequent hand washing, wearing a mask.
Yes.
Okay, thank you very much. We really appreciate
Thank
your
you for
time.
having me. Thank you.
Thank you for joining us this month. It was such a pleasure to speak with our Lehigh Valley Health Network Pocono providers. Next month, we'll have a fresh lineup of providers who will share information on how to keep you and your family healthy and safe. Stay safe, everyone.